Welcome, aloha. I'm Representative Corinne Ching, and this is our show called Harnessing Heritage. And this year, this show is focused on health of our community. We're very happy to have some guests with us today. We're going to talk about preventing diabetes, and this is part of an overall initiative that we're trying to establish in the community of Lili'uhanu'uanu, part of a vitality project. And it's actually being launched this month, the month of March, as it is Kidney Month. Kidney Month is held in March, and it is sometimes when diabetes is not addressed and prevented. Unfortunately, many of our diabetics go into have kidney failure. So with that, we are launching the first ever Green Anthurium Project. It's dedicated to a very special friend of mine who unfortunately was a victim of diabetes. Her name is Beverlyn Ho, and she was a third-generation Palama resident. We have here Green Anthurium on our show, and the reason we selected the Green Anthurium as a symbol of prevention of diabetes is because not only is it one of the longest living cut flowers, it's an export we have here in Hawaii, something we're very proud of, but it's green, and we're trying to remind people, please eat green, live green, please know the value of plants, even having a garden. Also, it's shaped like a heart, and we want to remind people, be gentle with yourself, be gentle with others, because when we have that graciousness in our lives and we live well, we are well, and health, our health is improved by relieving stress and making sure that we're having vital lives. And so that is really something that we hope to see more of. We're saying also when you're giving a gift, you know, maybe give a plant, give a green anthurium. Don't always have to give every time a cookie or something like that. And so joining us here today, we're so grateful to have to educate our audience on kidney health and diabetes. We have Dr. Jim Ireland, Director of the Honolulu Emergency Services Department and a specialized nephrologist. Thank you for joining us here today, Jim, I can call you Jim. And from American Diabetes Association of Hawaii, we are so pleased to have again Ms. Leslie Lamb, Executive Director of the American Diabetes Association here in Hawaii. Thank you, Leslie.
It's a pleasure to be here.
Thank you so much for joining us. And finally, we have Ms. Viola Genadio, Hawaii Community Leadership Board member and a registered nurse who's done so much in extensive work for American Diabetes Association of Hawaii. Excuse my voice, I've got a slight bit of laryngitis, but we'll get through it. Thank you, all of you, for joining us. Thank you so much, appreciate you. Well, to start us off, Dr. Jim Ireland, we would like you to tell us a little bit about yourself, your experience in this field regarding diabetes and kidney disease in Hawaii. As we all know, in my district, HMC East, better known to some as St. Francis Hospital, unfortunately we lost, but we realized that there's a number of factors that contributed to the bankruptcy of HMC, and we're grateful we have some measures that are have already been passed but are moving through the legislature to try to address our people's health, particularly the organ transplant is something we've been able to get with Queens. I know that there's going to be kidney, our organ program's going to be opening, having some kidney transplant there. But I wanted to talk about some of the factors of the cost of diabetes. Sure. And we know that Hawaii is one of the highest in per capita kidney failure, kidney disease, and it's something that hopefully we know can be prevented through maybe some different perspectives on how to live our life. And so with that, could you tell us a little bit about yourself, your background,
sure.
and what you do?
Yes, the first question I have is where would we find a plant like this if we wanted to give it for a gift?
Wonderful. Farmers markets,
Okay.
they're coming more, and we're going to be putting that on our website where you can find the green, it's called Midori originally, but we like to
Terrific.
call it the Prevent Diabetes, Show You Care Green Anthurium, but farmers markets, a lot of them.
Terrific, thank you. Well, I've had the pleasure of working for the City and County of Honolulu for about 2 years now, and Mayor Carlisle has reappointed me as the Director of Emergency Services. We oversee EMS, which is all the ambulances, and Ocean Safety, which is the lifeguard services for Oahu. It's a great team, and I'm really proud to be able to work with them. As a physician, though, I'm a board-certified internist and also a kidney specialist. And I've been practicing back in Hawaii here for about 6 or 7 years now. And as you mentioned, it is the highest per capita state with kidney disease. And of the patients I had seen in the past and see in clinic, we know that about half the patients have kidney disease from diabetes. The other approximately 40% have kidney disease from high blood pressure. And then there's about 5 or 10% who have kidney disease for other reasons, autoimmune conditions like lupus, hereditary conditions, and that sort of thing. But really, that's only about 5 or 10% of patients. So when we look at the vast majority of patients with kidney disease, and these are people with renal insufficiency, which is not symptomatic, they don't know they have it, all the way through to needing dialysis, which is the most extreme, 90% have diabetes, high blood pressure, or both. And so really, I think a goal in medicine, rather than react to these conditions once they've done damage to the body and have consequences, is to focus on screening so we can find out who has them, but also what we can recommend to people for lifestyle changes to prevent high blood pressure and diabetes, or for those who do have it, what can they do with their lifestyle and even medications to reduce the complications.
Absolutely, and you've seen firsthand over at HMC some of our local people. There's so many of our, particularly our ethnic groups of what is Native Hawaiian, Japanese, Filipino, some of the highest, isn't that right? So,
yeah, and the as you know, Representative, the Lehigh campus was founded in the 20s by the nuns, the 1920s, which is amazing. And through the years, they made it their focus and mission to take care of patients with kidney disease. So not only with dialysis, but transplantation, and that hospital became a leader in the state for the treatment of patients with kidney disease. And it was actually very sad to see what's happened, but encouraging to see now, at least with the transplant mission, that the Queens Medical Center is going to take that on.
yeah,
So there is benefit for those patients, because once the kidneys fail, the only treatment is dialysis or a transplant, and people do much better if they're able to get a transplanted kidney rather than stay on dialysis. Now, looking at causative factors, we talked about diabetes. Diabetes comes in 2 general categories. There's type 1 diabetes, which often affects children through no fault of their own. It's autoimmune, and that's the minority of the patients. Very few get that type of diabetes. The vast majority of patients with diabetes get it as an adult, and it's related to not only hereditary, like you alluded to with certain ethnic groups, but also with lifestyle. And particularly, we see when people gain weight, lack of exercise, and certain food choices, they're more likely to get diabetes. And I've seen my own patients, when they're able to change lifestyle, lose weight, get more exercise, and change their eating habits, diabetes can go away, which maybe not everybody realizes, but through, not with pills and not with physicians, but with education and what people can do with their own lifestyle, can actually, their diabetes can go away.
Absolutely, and that's why we do feel that we're working towards revitalizing the area of Liliha to clean up the buildings. We believe in historic preservation because we think if the buildings are more attractive and everything's cleaner, we are trying to draw our people out of their homes to walk around and also meet each other. We understand that when people get together, of course they're happier, they see their friends, and maybe that helps them to lower their stress levels, and that way they're fortified to make good food choices. And we have also a farmer's market coming up Tuesdays, starting in April, Tuesdays at the Nu'uanu Seventh-day Adventist Church there on Nu'uanu Avenue. I believe it starts at 4:30. So, but now, Dr. Ireland, what are some of the warning signs some of our listeners should look for? Warning signs of possible coming up with their diabetes?
That's the thing. Diabetes often doesn't have any signs, and neither does kidney disease until it's almost at the end stage, especially with kidney disease. Sometimes people can notice excessive thirst or excessive urination if their blood sugars are very high. But that's why we encourage people to get checked, because you can get screened often for free, and then you can find out if you're affected by one of these conditions. You can go to many of the health fairs around the community. I know there's one every year at the Chinese Cultural Plaza that we've attended, and they do a free screening for blood pressure and diabetes with a glucose check. But those types of health fair screenings that like we go to at the community center there are across the island, and people just have to watch out for those. Any fire station on Oahu will check your blood pressure for free. And so you can go in, there's hours usually posted in the front, and they will check your blood pressure. And if it's high, then you need to go seek care and get those issues addressed, so you don't have the complications that undiagnosed diabetes or hypertension can lead to.
Right, right. Even your eyes, right? I know that there's some, and that's what we want to do, is make sure people know how to tap in and start getting screened as soon as possible. If you're just joining us, I am Representative Corinne Ching, and you're watching Harnessing Heritage. I'm the representative of the Liliha Nu'uanu area, and today's program is helping us to be educated on diabetes and kidney failure here in Hawaii. And our guests on the program are Dr. Jim Ireland of Honolulu Emergency Services and Leslie Lamb of American Diabetes Association of Hawaii, as well as Viola Genadio, RN, and Hawaii Community Leadership Board member. Now, speaking of it, we have Ms. Leslie Lamb here from ADA, and she's already just had a wonderful fun run, I think, there on St. Patty's Day to raise awareness on diabetes. But she also is having a special event here at the state capitol, ADA, where they're going to raise awareness as well and have screenings on the 4th floor right here at the state capitol. And with us, the legislators, to commend you on all your good work. Leslie, would you like to talk about ADA and what you're doing in the state of Hawaii?
Sure, thank you. Our mission is to prevent and cure diabetes and to improve the lives of all people affected by diabetes. We do that in many different ways. We have many programs. Specifically, that is coming up on the 27th, we have Alert Day. We have a full-page ad in the Honolulu newspaper, Honolulu Star Advertiser, and it's going to be the Alert Day risk test. So we employ and we encourage everyone to open that paper up and take the diabetes risk test to see if they are at risk for diabetes. We also have that on our website, and we really want to be able to reach out with prevention tools and techniques. In Hawaii, we have 113,000 people here with diabetes, and of that, 28,000 don't know they have it yet. So we want to reach out to them to let them know that they do, or they may be at risk, and to take the next steps. We also have the cost of diabetes rising every year. Here in Hawaii, it's $1.038 billion a year for diabetes costs. And of that, $800 million goes to the complications of diabetes and the medical cost, and close to $300 million is loss of productivity. So on a large scale, it really is in our best interest for prevention activities. You know, just here in Hawaii and throughout nationally, it'll help us in the long run. And so we invite the public to come to our health fair. We have vendors there that'll help us with renal disease, with kidney disease, with eye disease, and all the complications of diabetes. So we invite the public, and we can't wait to speak with the different legislators to empower them with the knowledge of diabetes awareness.
Absolutely. Leslie, you've been here at the Capitol for some time, and we know of your great efforts and making sure people and the legislators know this is a silent disease, as Dr. Ireland discussed. It's a silent disease. It's something that is so important because HMC going bankrupt, we are aware. We have to look deeper than just the fact that it went bankrupt. We'll look at the causes, the root causes of some things, and besides that, it's just the more important thing is it's the heartache of our people, the hard part of losing a loved one, which I know what that's like, and seeing them go downhill.
It's awful, and it is serious. And I'd like to just let your visitors and your viewers know that statistically, nationally, 1 out of every 3 children born after the year 2000 will be diagnosed with type 2 diabetes by the age of 30. That is if the trends continue. What we're trying to do is change those trends in Hawaii because of our ethnicities. Native Hawaiians, Japanese, like you mentioned before, and Filipinos are at high risk. So because of that, it increases it to 1 out of every 2 children. So that is implorable. We can't let that happen. We want to spread awareness and prevention activities to stop that. And so we have different programs coming up that will help educate the public. And we really implore them to come, invite them.
Thank you. I know. I look forward to being there at your recess. There's also another event that you mentioned prior to this, the Diabetes Conference. This is Health Fair on April 14th, right, at the Hawaii Convention Center?
Yes, and it just so happens that we have a director of it. She's one of our local directors, so if you'd like to speak on that, that would be wonderful.
Ms. Genadio. Yes.
Yes. Actually, I'm Viola Genadio, and I'm actually a certified diabetes educator, and I'm also board certified in advanced diabetes management. But I did want to mention prevention really is the key, one of the important things. But also, there is a conference called Taking Control of Your Diabetes, and this is a really wonderful conference. It's very motivational, and it's for people with diabetes, their families, and we also have there's a professional component too. But it is the founder of this is Dr. Steve Edelman. And with this program, there is a cost. It's like $15, but it's all day. It's wonderful. It's all day, and it even includes lunch and it includes snacks. But the biggest thing of this is that there's various speakers. So the morning session will be sessions that everybody goes to, and they will listen to speakers. But in the afternoon, they'll have an opportunity to go to breakout sessions, so the person can pick the conference or the talks that they would like to go to. In addition to that, they can also go and talk to an endocrinologist, they can talk to a diabetes educator, they can have their feet checked. I mean, there's all these different things. They can exercise. There'll be a display area where they can go talk to different vendors, and if they want to learn about blood glucose meters, about the different kinds of medications, the American Diabetes Association will be there. There's just all kinds of things going on, so it's very motivational, very upbeat, and all the family can come, and it's been great. And we'll also have dietitians there, and you'll get a chance to talk to individuals.
It's perfect. I've been there actually in years past with Beverlyn Ho, who's the inspiration of our Green Anthurium Project, and I remember that there were booths there as well where people can get tested and see what's the sort of new technology coming out, right?
You'll get to see there'll be companies there that have different meters, because there are different meters. There'll be people showing the different types of insulins. There'll be different products out there so people can look and see what's available, and they can talk directly with the vendors and they can ask questions. And I think what's really important is the knowledge these people get, because really it's being knowledgeable and being able to know what you can do about it, and what kind of questions that you need to ask your doctor. So if you go to one of these sessions, for example, Dr. Steve Edelman, who is the founder of this, is also a type 1 diabetic, and he'll do an overview. You'll have other local speakers that will be there too, and Dr. Lori Tom is also the co-director with this. But you'll have an opportunity to see what is available, the kinds of new technology that's taking place, the new research, the new devices that are coming out, so that when you do go see your doctor, you can ask these questions. Or if you want to just speak to someone, like diabetes educator or an endocrinologist or a podiatrist, that person, you can go up and have that do that too. And also there'll be some eye screening done too.
Sure. Well, I do remember that, and I think that's fantastic. So once again, to recap, it's on this island because it's also on Maui.
Yes.
On Saturday, April 14th.
That's correct.
At the Hawaii Convention Center.
Yes.
I think our people can get to that. And on Maui, at the Maui Arts and Cultural Center, is
That's
that right?
correct.
It's Sunday, April 15th.
Yes, and that's a half-day program.
Perfect. I really encourage people to go. I was really impressed, and hey, $10, $15, that's worth it, right?
It
An
is.
investment in
It's
your
very
health.
motivational, very upbeat, and we've
Yeah.
always had positive comments.
People
about it.
fly in from
Yes.
the neighbor islands to attend it. It's about 3,000 people in attendance, and they leave with a bag of knowledge.
Yes.
Really, it's just amazing.
Excellent.
But one of the things I think that you hit on with that is that there's people there to check the feet. There's eye exams. But that just is a reminder of how many different organ systems
Are affected,
are affected by diabetes.
Yes.
It's high blood sugar, but what are the consequences?
Yes.
And we talked about what it can do to the kidneys. It can cause kidney failures.
Yes.
It can also cause blindness, and it can cause lack of circulation to the feet, where people can end up with amputations.
Yes.
So
Yes.
all dialysis, blindness, amputations, all very, very serious complications. And I think, again, going back to, let's get people
To the
screened.
core, yeah.
Let's get this
Really.
prevented.
Yes.
And not only are we saving money, but we're saving people's lives and
Yes.
livelihood.
Yes, and their quality of life. So true. And
Absolutely.
I was told at a recent seminar, Alzheimer's a big, also, people don't realize even Alzheimer's. So all the organs that's related.
Yeah. And going back to the farmers market, I think seeing the resurgence of those, I'm glad to hear there's one in Laliha,
Yeah.
because you can get good, healthy food there.
Yes.
Take the family. Don't just walk around once, but make about 4 or 5 laps, and you can get some exercise too.
That's right.
Really here in Hawaii, there's such good weather almost all year
Yes,
round, and we have
yes.
such wonderful parks. We have city pools, we have the ocean, lots of different places to exercise, including the YMCA, the gyms you can subscribe to. There's really a lot of opportunity to get out and get moving, and I tell myself that every morning too.
Yes.
Got to get active.
Absolutely. That and one of the things to help us, get active is that positive mental attitude where you feel fortified that, oh, I know I'm tired, but today I'm going to do the right thing and I'm going to go get that vegetable and make it fun. As I used to be an elementary school teacher, I know that my students, young kids, they learn better when we're having fun, and that's one of the reasons we try to do activities in the community is to get people out of their houses for a fun activity. We wanted to remind people we do have the New Oahu Farmers Market coming up in April. We do hope people will come out for that. And we have a couple initiatives that we do try to share with people. Remember now, just, we are born and raised on rice often, but brown rice more nice. That's one way to remember it. And we want to work, with restaurants for maybe half portions. And not every day plate lunch. We can always have other things like poi.
Tell us about some substitution foods, because this is something as a physician I don't know enough about, and I need to get that information for my patients, but substitution foods for lowering sugar and this sort of thing.
Yeah.
Well, I'm not a dietitian, I'm a nurse,
Yeah.
but in terms of, I just want to say there really is no diabetic diet. It's basically healthy eating.
Balance.
And so when you're looking at, when you look at foods in themselves, the biggest impact on the blood sugar is going to be carbohydrates. And so again, limiting the portion sizes, because people think they can't have a cookie or a piece of cake. They can, as long as it's worked into the meal pattern. And so I don't know in terms of what type of substitutions. I mean, if you go to for a plate lunch, maybe not having as much rice, they're asking them if you can have green salad on top of that. Instead of fried, doing it baked.
Green salad instead of mac salad.
Yes, macaroni salad.
Yes.
Yeah, because most of the plate lunches come with macaroni salad, or they come with 2 scoops of rice. And I think some of the restaurants are recognizing that too. They're beginning to substitute, or if you ask, they'll be able to substitute. And so I think that's a plus, or even getting some of the awareness of what types of foods, when you go on a menu and look and see what are healthier foods. There's those are examples. People say, can I have soda? Yeah, diet soda is fine, but it's the regular soda that's the problem. Like juices, but for example, it's probably better to eat the fruit than to drink the juice. And then
or water.
Or water, yes.
Water's okay,
Water's
right?
okay,
Water's
yes,
a good
water's
idea.
great.
Having those bottles. I mean, my daughter's elementary school, bottles of water. Water's, keep it, maybe put a few ice cubes and rediscover the beauty of water.
Well, it's so good here. The water
Cleanest and,
is terrific.
Yeah.
And it's free.
There you go.
Right.
So, we're about to wrap up, but how can our listeners get involved with the ADA? How can they get involved with what you're doing and know more about the ADA? You want to give a website?
Of course. Please visit us at diabetes.org/Hawaii.
Good.
And call our office 947-5979. And I'd just like to leave you with the perfect plate, or a balanced plate would be half of your plate with colorful vegetables.
Yes.
Whether fresh vegetables, even better, but if you have some cooked vegetables, that's fine too, especially without butter or salt. And then the other half of your plate, a moderate portion of protein and a little bit of starch. I mean, so just, it's moderation, really.
Perfect. That's the visual. Yes. We have a minute to go. Dr. Ireland, thank you so much for telling us all about what we can do and your background. Thank you so much for your expertise.
Thank you for all your hard work in Laliha.
Oh, it's a labor of love. It really is. And for us, if you ever need to get in contact with our office or would like to, in our Green Anthurium Project, it's Rep Ching at capitalhawaii.gov. And we're working on these things, and we'd like to be sort of a model, perhaps, someone, the district that you can point to and say, wow, we made some progress here for our people, because they are so precious. And this is, again, in memory of a very vital woman, Beverlyn Ho, who I tell you, and she was really something, and I think she passed away way too quickly at 62, and we wish that we had maybe been able to do more back then, but we will do it for others, and we will make sure that others don't succumb to some of those same problems. And our local people, they're our treasures, and we want to make sure that our people are living great lives, long lives, and that's why we started the Green Anthurium Project. And thank you so much.
Welcome.
Thank you,
pleasure.
all of you. We look forward to seeing you on the 27th.
Yes,
right?
right around the corner.
So thank you so much for joining in. It's worth it. We're getting there. We're learning more about diabetes and how we can really prevent it, since it's unnecessary in many of the cases. Right. Thank you so much for joining us.
Thank you. It's a pleasure. Thank you very much.